Dr. Tan Wu Ming.
Madam Deputy Speaker, may I have your permission to answer question 5 and 6 together, please?
Please go ahead.
My response will also cover the matters raised in the written question by Mr. Sean Huang, which is scheduled for a subsequent sitting. I will invite the member to seek clarifications if need be. If the question has been addressed, it may not be necessary for him to proceed with the question for future sitting. Let me first give an update on the current COVID-19 infection wave. By all indications, the wave peaked about 2 weeks ago at an estimated 4,000 infection cases per day. It has since subsided to about 3,000 infections per day. The key strains circulating are XBB 1.9, XBB 1.16, and XBB 2.3, each accounting for about a quarter of all infections. WHO has redesignated XBB 1.16 from being a variant under monitoring to a variant of interest. There is, however, no evidence internationally or locally that any of the variants have a clear growth advantage over the others or can lead to more cases of severe illnesses. MOH will continue to monitor the characteristics of the various strains. There are now over 300 patients infected with COVID-19 and in our hospitals. It is a fraction of the hospitalizations at the peak of the pandemic. That was about Delta wave, about 1,800. Now it's about 300 plus. But nevertheless, that added significant workload to our hospitals. We should also see the number of COVID-19 hospitalizations falling in the coming week as the infection wave subsides. Now, this is the first infection wave we have encountered after transiting to DORSCON Green and treating COVID-19 as an endemic disease. We have weathered through it without imposing any further public health measures. Many members of public, in fact, are even not aware that we are undergoing a COVID infection wave. This is what we have planned for when we transited to DORSCON Green, and it is another important and noteworthy milestone. However, we can maintain this public health posture provided that we continue to take our COVID-19 vaccinations. It is of critical importance that we understand that COVID-19 did not become a milder disease because we transit to DORSCON Green. WHO no longer declare COVID-19 as a public health emergency of international concern, but it also added that it does not mean that COVID-19 is no longer a threat. In fact, it remains a dangerous disease. But our population resilience has strengthened due to vaccinations, boosters, and safe recovery from infections. These are the reasons that enable us to treat it as an endemic disease. So it is of critical importance that we continue to take vaccinations based on MOH's latest recommendations to keep the level of our resilience high. To illustrate what I just said, let me share some data collated over the first 4 months of 2023. Senior aged 60 and above continue to be more vulnerable to developing severe illnesses if infected with COVID-19. But amongst these seniors, the incidence of severe illnesses, i.e., the infected persons need to be hospitalized or require oxygen supplementation, they differ depending on the vaccination status of the individuals. So I'm going to cite some incidence rates of severe illnesses, but please bear in mind what I'm about to cite are overestimates, because these days cases are underreported. So these are overestimates. But the point in the comparison is still the same. For those seniors above 60 and above who are unvaccinated, about 7.5% of them develop severe illnesses and have to be hospitalized, 7.5%. For those with minimum protection, i.e. 3 doses of mRNA or Novavax or 4 doses of Sinovac, the rate of severe illnesses was about 4%, half that of those who are unvaccinated. For those with minimum protection and kept their vaccination status up to date, i.e. most of them got themselves boosted and their last shot is less than 12 months ago, the incidence rate of severe illnesses is even lower at 3.4%. So it's 7.5%, 4%, 3.4%. Hence, if you are aged 60 and above or are vulnerable due to underlying illnesses, please get your minimum protection of 3 shots of mRNA or Novavax or 4 shots of Sinovac as soon as possible, if you have not already done so. And if you have minimum protection, please take a booster every year. This will enhance your protection against Omicron variants and minimize the risk of being infected and developing severe illnesses. Unfortunately, despite the benefits of vaccinations, among seniors aged 60 and above, the proportion who are updated with their vaccinations have been declining. That was 58% at the beginning of this year. It has slowly declined to 50% currently. Because once they pass their 12-month mark, they are no longer updated. So every day, every week, that number is dropping. Now it's only 50%. So if this trend continues, our resilience against COVID-19 will weaken over time, making ourselves vulnerable to the virus again. Falling vaccinations, even amongst vulnerable segments of the population, is due to a few reasons. First, there's a common thinking among seniors and amongst the public that I seldom go out of my home, and hence I don't have to take the vaccinations. This is not recommended. The current Omicron variants are highly infectious, and we no longer impose social restrictions, which means even if you do not go out of your home, it can find their way to your home through visiting family members or anyone you may come into contact with. So it's much better, get the vaccinations and consider going out from time to time. Meet friends, have coffee, join us for group exercises. It is actually good for your health. Second, some seniors are also concerned about the risk of side effects if they take further vaccination shots. To date, hundreds of millions of doses of vaccines have been administered globally. The incidence of severe adverse reactions is very low in Singapore, at about 7 in 100,000 doses, and it is even lower at 1 in 100,000 doses with the latest bivalent mRNA formulations. These severe adverse reactions mostly are myocarditis, anaphylaxis, serious allergic reactions, and most resolved after some treatment. So let me summarize. What's the deal? If you belong to a vulnerable segment of the population and choose not to take vaccinations, there is a significant chance that you will get infected at some point by the Omicron variant, which can cause severe illnesses like hospitalization, oxygen supplementation. If you attain minimum protection and keep your vaccination status updated through boosters, the chance of developing severe illnesses will be significantly reduced if you are infected. There is an added risk of developing severe adverse reaction after vaccination, but that is very low, especially with the new bivalent formulations. In other words, the benefits of COVID-19 vaccines continue to far outweigh the risk, and you should keep your vaccination updated. This is the recommendation of both EC19V as well as the HSA. Now, specifically on myocarditis, this is a known illness associated with infections, including by COVID-19 virus. It can also occur, albeit at a lower probability, when taking COVID-19 vaccines, and it tends to affect young males, aged 12 to 30 years old. The local incidence of vaccine-related myocarditis in this age group is low, at about 1 in 100,000 doses, and it is even lower at 0.1 in 100,000 doses with the latest bivalent mRNA formulations. As of 27 April 2023, out of more than 17 million COVID-19 vaccine doses administered in Singapore, there were 160 reports of myocarditis and pericarditis linked to the vaccines. 32% of these cases had initial symptoms reported within 1 day of vaccination, another 20% reported within 2 days, and another 24% reported within 1 week. The majority of cases of myocarditis from vaccination are generally mild and respond to treatment. As of 27 April 2023, About 340 vaccine injury financial assistance program or VIFAP applications are cardiology related. 81 of the applications were approved and financial assistance have been extended to the applicants. Myocarditis was picked up as a safety signal and reported in June 2021. A look back at VIFAP applications from before June 2021 did not identify anyone with myocarditis. At present, COVID-19 vaccines are not known to be causally associated with any other cardiac conditions other than myocarditis.
Dr. Tan Wu Ming.
I thank the Minister for his detailed answer and exposition. I declare that I'm a medical doctor at a public hospital, and I've seen firsthand how vaccination has saved lives when people are ill with COVID-19. I raise this parliamentary question in my capacity as Member of Parliament. Deputy Speaker, there are Clementi residents, fellow Singaporeans, who early in the pandemic underwent COVID-19 vaccination to protect themselves, their loved ones, and the community. Some had applied for VIFAP, the Vaccine Injury Financial Assistance Program. Can I ask the Minister two supplementary questions? Firstly, would Minister agree that if the policy intent of VIFAP is to provide goodwill financial assistance to persons whose serious side effect was assessed to be related to the vaccination, then the assessment must be based on the latest, up-to-date scientific and medical understanding. Secondly, would Minister consider that as the understanding continues to improve, older VIFAP cases should be subject to retrospective review closer to the 3-year dates of limitation of claims, so that the latest up-to-date scientific and medical understanding can be applied to older cases as part of that review? Thank you.
Minister.
Thank you. The answer to both questions are yes. VIFAP applications have to be based on scientific and medical assessment. That's why we have an independent group of doctors who assess the VIFAP applications. And of course, if there are new understanding, new findings, establishing the causal links of adverse reactions versus vaccines, all cases will be relooked at.